Hey everybody, Dr. Blake Cason here. Thank you for staying tuned. Today we're going to be talking about something called self-adjusting. Is it good for you or is it bad for you? So self-adjusting is when a person's usually at their desk, maybe working on the computer, they're not feeling very well, they're feeling kind of tired, and they start adjusting their neck. Usually it looks something like that. You've probably seen it 100 times. Some of them look a little crazy, some of them you can't even tell people are doing it, but they're going to take this and then just this way, that way. Maybe they'll be sitting in their chair and they rotate real hard and you hear it run up their spine. Very common thing people do to relieve tension. Sometimes they're doing it just as a stress reliever because they do it so much, it almost becomes a habit for them. So we call it a bad habit, and there's reasons for that. So, what I want to take a look at today is what exactly is going on there. What are you doing to your spine? How can you help your spine? And today we're going to take a closer look at what's going on in that self-adjustment process. Okay, so we're back with the nerve supply guy. What we're going to do is we're going to take a closer look at the nerve supply. So we're in the neck today. These are your 7 cervical vertebrae that we're talking about. Most popular area that most people are going to adjust, self-adjusting at their desk, is usually their neck because they get kind of fatigued through the area. They get stuck in the keyboard position, with the monitor or the screen in front of them, and this all starts to ache, right? So they want to adjust it because they know it feels better. Why does it feel better? You're going to start during that process. They're stretching, so it feels better. They get a little more blood flow through there. Some endorphins are being released when the joint moves. But what they're doing is they're actually taking the area that's misaligned. Let's say here it's at the lower portion of their neck. When they start doing that self-adjusting, they're reinforcing the misalignment because it's going to reset. These joints are going to reset on top of that nerve, and that's a bad thing, especially when it's compounded over time. So what I tell people to do, especially the new patients, is I say, let me be the one to adjust you once or twice a week, and you'll see that urge to start adjusting yourself will go down because A, you know it's bad, but also you're getting better with my care because when I adjust you, I'm going to reinforce the correction because that's what a chiropractor is trained to do. And a lot of times the new patient will say, Doc, well, it actually makes me feel better and I've been doing it for years. But what I'm telling them is they've been damaging that area. Not only are the ligaments in that area and the joints being stretched like a rubber band every time they do it, but they're doing it so much. And what happens to that rubber band every time it stretches too much, right? It breaks. So my point in saying that is if you're adjusting yourself 2 to 3 times a day just because it feels good every day, imagine if I was doing that to a patient. That would be considered malpractice and they'd put me in jail. So I don't think that's a good avenue for that patient to go. So first thing that I want to do is make sure that the joint's moving properly and we start making it work better and taking pressure off their nervous system, and the patient starts to feel better. And once they understand that concept, they just get better. And that's one of the bad habits that we eliminate here at the office.